Welcome to this nursing review on the cardiac system. The cardiac system is the powerhouse of circulation, responsible for delivering oxygen and nutrients to tissues. We'll explore common conditions like heart failure and arrhythmias, and more. For each section, we will discuss signs and symptoms, treatment, nursing interventions, and patient education to promote cardiovascular health. This video is a quick recap on everything you need to know for NCLEX and nursing school exams. So let's begin. Aortic aneurysm. An aortic aneurysm is a localized dilation of the aorta due to weakening of the arterial wall. It can occur in the thoracic or abdominal region. Contributing factors are the following: atherosclerosis, which is the most common cause, hypertension, smoking, genetic disorders such as Marfan syndrome, age over 60 years. Manifestations are the following: often asymptomatic until rupture, pulsating abdominal mass in abdominal aneurysms, back or chest pain in thoracic aneurysm. Symptoms of rupture include sudden, severe pain, hypotension, and signs of shock. Diagnostic procedures are the following: ultrasound for abdominal aneurysms, CT scan or MRI for detailed visualization of size and location, angiography used for surgical planning. Nursing actions are the following: monitor blood pressure closely to avoid rupture. Assess for signs of impending rupture, such as sudden pain and hypotension. Maintain a calm environment to prevent stress-induced blood pressure spikes. Treatment options are the following: medical, using antihypertensives to control blood pressure; surgical, including endovascular aneurysm repair or open surgical repair for aneurysms greater than 5.5 centimeters or ruptured. Patient education includes the following: smoking cessation and managing hypertension are critical. Adherence to follow-up imaging to monitor aneurysm size. Recognize signs of rupture and seek immediate medical attention. Angina. This is chest pain resulting from myocardial ischemia, categorized as stable or unstable. Contributing factors are the following: coronary artery disease, physical exertion or stress, smoking and obesity, anemia due to decreased oxygen carrying capacity. Manifestations are the following: stable, predictable chest pain triggered by exertion or stress, relieved by rest or nitroglycerin. Unstable, chest pain at rest or with minimal exertion, not relieved by nitroglycerin. Diagnostic procedures are the following: electrocardiogram or ECG, which will show ST segment depression during episodes. Stress testing assesses myocardial response to exercise. Coronary angiography, which will identify blockages in coronary arteries. Nursing actions are the following: administer prescribed nitroglycerin for pain relief. Monitor ECG changes and vital signs during episodes. Educate the patient to identify and avoid triggers. Treatments are the following: medications include nitroglycerin, beta blockers, and calcium channel blockers. Lifestyle modifications involve diet, exercise, and smoking cessation. Surgical options include percutaneous coronary intervention or PCI, if the condition is severe. Patient education is the following: teach the correct use of nitroglycerin sublingually. Manage stress and incorporate relaxation techniques. Recognize when to seek emergency care for chest pain. Myocardial infarction. An MI, which is also known as a heart attack, is the death of myocardial tissue due to prolonged ischemia caused by a blockage in the coronary arteries. Contributing factors are the following: atherosclerosis and coronary artery disease, hypertension and diabetes mellitus, smoking, obesity, and high cholesterol. Manifestations are the following: severe, persistent chest pain radiating to the jaw, neck, or left arm, dyspnea, diaphoresis, and pallor, nausea, vomiting, and a sense of impending doom. Diagnostic procedures are the following: troponin levels, which will show elevated in myocardial damage, ECG with an ST segment elevation, STEMI, or non-ST elevation, NSTEMI. coronary angiography, which identifies the blockage causing the MI. Nursing actions are the following. Initiate oxygen therapy and administer aspirin as prescribed. Monitor ECG and vital signs for arrhythmias or hemodynamic instability. Prepare the patient for reperfusion therapy, either PCI or thrombolysis. Treatments are the following. Reperfusion therapy, PCI or thrombolysis within 90 minutes of onset. Medications, beta blockers, ACE inhibitors, antiplatelets like aspirin and clopidogrel. Long-term management, lifestyle changes, and cardiac rehabilitation. Patient education is the following. Teach the importance of medication adherence. Lifestyle changes to manage risk factors, such as cholesterol and smoking. Recognize early warning signs of recurrent myocardial infarction. Coronary artery disease. Coronary artery disease is the narrowing or blockage of coronary arteries due to atherosclerotic plaque, leading to decreased myocardial blood flow. Contributing factors are the following: hyperlipidemia and hypertension, sedentary lifestyle and smoking, obesity and diabetes mellitus. Manifestations are the following: angina or chest pain, fatigue and shortness of breath. In severe cases, MI or sudden cardiac arrest. Diagnostic procedures are the following: lipid profile, elevated LDL, low HDL, high triglycerides. Stress testing, which identifies myocardial ischemia. Coronary angiography, which determines the location and severity of blockages. Nursing actions are the following: monitor for signs of angina or myocardial infarction. Educate the patient about lifestyle changes to slow disease progression. Administer prescribed medications, such as statins. Treatments are the following. Medications include statins, antiplatelets, and beta blockers. Surgical options include PCI or CABG for severe blockages. Patient education is the following: regular physical activity and a heart-healthy diet, adherence to medications and follow-up appointments, avoidance of smoking and stress. Peripheral arterial disease. Peripheral arterial disease is the narrowing or blockage of peripheral arteries, usually in the legs, due to atherosclerosis. This condition leads to reduced blood flow. Contributing factors are the following: smoking and diabetes mellitus, hypertension and hyperlipidemia, obesity and advanced age. Manifestations are the following: intermittent claudication, which is pain in the legs during exercise, relieved by rest, cool pale skin and weak or absent pulses, non-healing wounds or ulcers on the extremities. Diagnostic procedures are the following: ankle brachial index, compares blood pressure in the arms and legs, Doppler ultrasound, assesses blood flow, angiography, locates blockages. Nursing actions are the following: monitor for skin breakdown and signs of infection, educate on proper foot care and smoking cessation, encourage gradual physical activity to improve circulation. Treatments are the following: medications, antiplatelets such as aspirin or clopidogrel, and statins, surgical angioplasty or bypass surgery for severe cases. Patient education is the following: avoid cold exposure to prevent vasoconstriction, inspect feet daily for injuries or ulcers, maintain blood sugar and blood pressure control. Cardiac tamponade. Cardiac tamponade occurs when fluid accumulates in the pericardial sac, compressing the heart and restricting its ability to pump effectively. Contributing factors are the following: pericarditis, which is the inflammation of the pericardium, trauma or chest injuries, malignancies or cancer treatments, and post-cardiac surgery complications. Manifestations are the following: Beck's triad, which includes hypotension, muffled heart sounds, and jugular vein distension. Pulsus paradoxus, a drop in systolic blood pressure during inspiration. And finally, tachycardia and restlessness. Diagnostic procedures are the following: echocardiogram confirms fluid accumulation around the heart. Chest X-ray shows an enlarged cardiac silhouette. Electrocardiogram, or ECG, reveals low-voltage QRS complexes. Nursing actions are the following: Monitor for signs of hemodynamic instability. Prepare the patient for an emergency pericardiocentesis. Maintain intravenous access for fluid resuscitation if needed. Treatments are the following. Emergency pericardiocentesis involves the removal of fluid via needle aspiration. Surgical pericardial window is performed for recurrent effusions. Patient education is the following. Emphasize the importance of follow-up care for underlying causes. Recognize signs of recurrence, such as chest pain or dyspnea. Cardiogenic shock. Cardiogenic shock occurs when the heart fails to pump enough blood to meet the body's needs, leading to organ hypoperfusion. Contributing factors are the following: acute myocardial infarction, which is the most common severe heart failure, cardiac tamponade or valvular heart diseases, and cardiomyopathy. Manifestations are the following: hypotension and tachycardia, cool, clammy skin and delayed capillary refill, reduced urine output, and altered mental status. Diagnostic procedures are the following: hemodynamic monitoring, which reveals low cardiac output and high pulmonary capillary wedge pressure, echocardiogram, used to assess heart function and valve integrity, and ECG, which identifies myocardial infarction or arrhythmias. Nursing actions are the following: administer oxygen and monitor oxygen saturation. Prepare for the administration of inotropic agents, such as dobutamine. Also, monitor for complications like arrhythmias or renal failure. Treatments are the following: medications including vasopressors and inotropes, and mechanical support, such as an intra-aortic balloon pump or a ventricular assist device. Patient education is the following. Understand the importance of managing underlying causes, for example, controlling myocardial infarction risk factors, and attend follow-up appointments for heart function evaluation. Cardiomyopathy. Cardiomyopathy is a group of diseases affecting the heart muscle, impairing its ability to pump blood. Types include dilated, hypertrophic, and restrictive cardiomyopathy. Contributing factors are the following: genetic predisposition, chronic hypertension, alcohol abuse or substance use, viral infections or autoimmune diseases. Manifestations are the following: fatigue and dyspnea on exertion, palpitations and chest pain, peripheral edema which indicates the late stage. Diagnostic procedures are the following: echocardiogram, which shows heart muscle abnormalities, cardiac MRI, providing detailed imaging of myocardial structure, and biopsy, which is rarely done but confirms the type of cardiomyopathy. Nursing actions are the following: monitor for worsening heart failure symptoms such as edema and weight gain, educate the patient about sodium and fluid restrictions, administer prescribed medications, and monitor their effects. Treatments are the following: medications including beta blockers, ACE inhibitors, diuretics, and antiarrhythmics. Advanced therapies such as implantable cardioverter defibrillators or heart transplantation. Patient education is the following: lifestyle changes like smoking cessation, alcohol moderation, and regular exercise. Recognize signs of disease progression and seek timely care. Endocarditis. Endocarditis is an infection of the inner lining of the heart, often involving the heart valves caused by bacteria, fungi, or other pathogens. Contributing factors are the following: prosthetic heart valves, rheumatic heart disease, intravenous drug use, invasive procedures such as dental work. Manifestations are the following: fever, chills, and night sweats, a new or worsening heart murmur, Osler nodes, which are painful nodules on fingers or toes, and Janeway lesions, which are painless spots. Diagnostic procedures are the following: blood cultures identify the causative organism. Echocardiogram detects vegetations on heart valves. CBC may show leukocytosis and anemia. Nursing actions are the following: administer antibiotics as prescribed and monitor for adverse reactions. Assess for signs of embolization, for example, stroke or splenic infarction. Educate about infection prevention practices. Treatments are the following: Antibiotics, long-term intravenous antibiotics based on culture results. Surgical intervention valve replacement for severe cases. Patient education is the following. Emphasize prophylactic antibiotics before invasive procedures. Maintain good oral hygiene to reduce bacteremia risk. Adherence to follow-up care to monitor for recurrence. Heart failure. Heart failure is a chronic condition where the heart cannot pump enough blood to meet the body's needs. Types include left-sided, right-sided, and congestive heart failure. Contributing factors are the following: hypertension and coronary artery disease, myocardial infarction, cardiomyopathy or valvular diseases. Manifestations are the following: left-sided pulmonary congestion, dyspnea, orthopnea, and crackles. Right-sided peripheral edema, ascites, and jugular vein distension, fatigue and exercise intolerance. Diagnostic procedures are the following: echocardiogram, assesses ejection fraction and heart structure, BNP levels, elevated in heart failure. Chest X-ray shows pulmonary congestion or cardiomegaly. Nursing actions are the following: monitor daily weights and fluid balance, administer diuretics and monitor for electrolyte imbalances, educate about signs of decompensation, such as sudden weight gain or worsening dyspnea. Treatments are the following. Medications include diuretics, ACE inhibitors, beta blockers, and digoxin. Advanced therapies may involve VADs or heart transplantation in severe cases. Patient education is the following. Adhere to a low-sodium diet and fluid restrictions. Understand the importance of medication adherence and symptom monitoring. Engage in regular, moderate exercise as tolerated. Hypovolemic shock. Hypovolemic shock occurs due to significant fluid loss, leading to inadequate blood volume and tissue perfusion. Contributing factors are the following: hemorrhage, which can result from trauma, surgery, or gastrointestinal bleeding; severe dehydration, often caused by vomiting, diarrhea, or burns; and third space fluid shifts, such as those seen in pancreatitis or peritonitis. Manifestations are the following: hypotension and tachycardia, cool, clammy skin with delayed capillary refill, and oliguria, along with altered mental status. Diagnostic procedures are the following: vital signs, low blood pressure, increased heart rate, hemoglobin and hematocrit, decreased in hemorrhage, lactate levels elevated, indicating hypoperfusion. Nursing actions are the following: establish IV access for rapid fluid resuscitation. Monitor for signs of organ dysfunction like decreased urine output. Administer oxygen to improve tissue oxygenation. Treatments are the following: fluids crystalloids such as normal saline or lactated ringers for volume replacement, blood products, transfusion for hemorrhage, vasopressors, if fluid resuscitation is insufficient. Patient education is the following: prevent dehydration by maintaining adequate fluid intake, recognize early signs of bleeding or fluid loss, follow up for management of underlying conditions. Myocarditis. Myocarditis is inflammation of the heart muscle, often caused by infections, toxins, or autoimmune conditions. Contributing factors are the following: viral infections, for example, Coxsackie virus and adenovirus; autoimmune disorders such as lupus and rheumatoid arthritis; and exposure to toxins including alcohol, drugs, and radiation. Manifestations are the following: fatigue, chest pain, and palpitations; shortness of breath and signs of heart failure; fever and flu-like symptoms in viral cases. Diagnostic procedures are the following: echocardiogram assesses heart function; ECG may show arrhythmias or ST segment changes; cardiac MRI identifies inflammation. Nursing actions are the following: monitor for arrhythmias and signs of heart failure; administer anti-inflammatory medications as prescribed; educate on the importance of rest and activity restriction. Treatments are the following: medications, antiviral or immunosuppressive therapy, depending on the cause; supportive care, diuretics, and ACE inhibitors for heart failure symptoms. Patient education is the following. Avoid strenuous activities during recovery. Recognize early signs of worsening symptoms like increased fatigue or swelling. Follow up with cardiology for long-term monitoring. Pericarditis. Pericarditis is inflammation of the pericardium, the thin sac surrounding the heart. Contributing factors are the following. Viral or bacterial infections, post-myocardial infarction, also known as Dressler's syndrome, autoimmune diseases such as lupus. Manifestations are the following. Sharp pleuritic chest pain relieved by sitting up and leaning forward. Pericardial friction rub, which is a scratchy sound heard on auscultation. Low-grade fever and dyspnea. Diagnostic procedures are the following. ECG, which shows widespread ST segment elevation. Echocardiogram, used to detect pericardial effusion. Chest X-ray, which may show an enlarged cardiac silhouette if effusion is present. Nursing actions are the following. Monitor for signs of tamponade, such as hypotension and jugular venous distension. Administer prescribed NSAIDs or corticosteroids. Educate on medication adherence and symptom monitoring. Treatments are the following. Medications like NSAIDs, colchicine, or corticosteroids. Pericardiocentesis, which is used for large effusions causing tamponade. Patient education is the following. The importance of completing treatment for underlying infections. Avoid strenuous activities until symptoms resolve. Report worsening symptoms promptly. Pulmonary edema. Pulmonary edema. Pulmonary edema is the accumulation of fluid in the alveoli, leading to impaired gas exchange and respiratory distress. Contributing factors are the following. Left-sided heart failure, which is the most common cause. Acute myocardial infarction, kidney failure, and fluid overload. Manifestations are the following. Severe dyspnea and orthopnea, pink frothy sputum, which is a classic sign. Crackles on auscultation and cyanosis. Diagnostic procedures are the following. First, a chest X-ray, which shows fluid in the lung fields. Next, ABGs, indicating hypoxemia and respiratory acidosis. Finally, an echocardiogram, which identifies heart failure as the underlying cause. Nursing actions are the following. Administer high-flow oxygen or non-invasive ventilation such as CPAP. Monitor fluid intake and output closely. Administer diuretics and monitor for electrolyte imbalances. Treatments are the following. Medications include diuretics like furosemide, vasodilators, and inotropes if heart failure is severe. Mechanical ventilation may be necessary in cases of severe respiratory failure. Patient education is the following. Emphasize the importance of adhering to fluid restrictions. Encourage patients to report early signs of fluid retention, such as weight gain or swelling, and of course follow dietary recommendations, including a low-sodium and heart-healthy diet. Raynaud's disease. Raynaud's disease is a condition causing vasospasms in the small arteries of the fingers and toes, triggered by cold or stress, leading to reduced blood flow. Contributing factors are the following. Primary unknown cause, often idiopathic. Secondary associated with autoimmune diseases like lupus or scleroderma. Risk factors include smoking, stress, cold exposure, and family history. Manifestations are the following. Episodic color changes in affected areas, typically white to blue to red. Numbness, tingling, or pain during attacks. In chronic cases, there may be skin thickening or ulcers. Diagnostic procedures are the following. Cold stimulation test, which measures response to cold exposure. Nail fold capillaroscopy, which assesses capillaries near the nails for abnormalities. And blood tests, which are used to rule out autoimmune conditions. Nursing actions are the following. Assess triggers and frequency of attacks. Monitor skin integrity in affected areas, and educate on prevention strategies. Treatments are the following. Medications such as calcium channel blockers, for example nifedipine, to relax blood vessels, and lifestyle changes like avoiding triggers such as cold and smoking cessation. Patient education is the following. Wear gloves and warm clothing in cold environments. Manage stress to reduce the frequency of attacks, and report any ulcers or persistent pain to a healthcare provider. Rheumatic heart disease. Rheumatic heart disease is a chronic condition resulting from rheumatic fever, causing damage to heart valves due to an autoimmune response to a streptococcal infection. Contributing factors are the following: recurrent or untreated streptococcal throat infections, socioeconomic factors such as poor access to healthcare, and genetic predisposition. Manifestations are the following: symptoms of valvular dysfunction, which include dyspnea, fatigue, palpitations, and chest pain, fever and joint pain, and murmurs from valve damage. Diagnostic procedures are the following: echocardiogram, which detects valvular abnormalities, throat culture or ASO titer to confirm a streptococcal infection, and a chest X-ray, which identifies cardiomegaly or pulmonary congestion. Nursing actions are the following: monitor for signs of heart failure, administer antibiotics and anti-inflammatory medications as prescribed, and educate on long-term penicillin prophylaxis. Treatments are the following: medications including antibiotics for streptococcal infection and diuretics for heart failure, and surgical interventions like valve repair or replacement for severe cases. Patient education is the following: complete all antibiotic regimens to prevent recurrence, recognize early symptoms of valve dysfunction, and maintain regular follow-ups with a cardiologist. Thrombophlebitis. Thrombophlebitis is inflammation of a vein associated with thrombus or clot formation. It most commonly occurs in superficial or deep veins of the lower extremities. Contributing factors are the following: Virchow's triad, venous stasis, endothelial injury, and hypercoagulability. Risk factors include prolonged immobility, obesity, pregnancy, varicose veins, and smoking. Manifestations are the following: redness, swelling, and warmth over the affected vein, pain and tenderness along the vein, positive Hohmann's sign. Diagnostic procedures are the following: Doppler ultrasound detects venous thrombus, the D-dimer test where elevated levels indicate clot presence, and venography, which visualizes venous structure and blockages. Nursing actions are the following: assess for signs of complications, such as deep vein thrombosis or pulmonary embolism. Elevate the affected extremity to promote venous return. Administer anticoagulants as prescribed. Treatments are the following: medications, heparin or low molecular weight heparin, followed by oral anticoagulants. Compression therapy, support stockings to reduce swelling. Patient education is the following: importance of early mobilization and avoiding prolonged immobility. Adherence to anticoagulation therapy and monitoring for bleeding. Report sudden chest pain or shortness of breath immediately. Atrial fibrillation. Atrial fibrillation is an irregular, often rapid heart rhythm originating in the atria, leading to ineffective atrial contraction and increased risk of clot formation. Contributing factors are the following: hypertension, coronary artery disease, heart failure, hyperthyroidism or sleep apnea, excessive alcohol or caffeine intake. Manifestations are the following: palpitations and irregular pulse, fatigue and shortness of breath, increased risk of stroke due to thromboembolism. Diagnostic procedures are the following: ECG, which shows irregular RR intervals, absent P waves, and fibrillatory waves; echocardiogram, which assesses atrial size and thrombus presence; and Holter monitor, which evaluates episodic atrial fibrillation. Nursing actions are the following: monitor heart rate and rhythm closely, administer prescribed anticoagulants and rate control medications, and educate on stroke prevention strategies. Treatments are the following: medications, such as beta blockers, calcium channel blockers, or anticoagulants. Cardioversion, which can be electrical or pharmacologic to restore normal rhythm. And ablation therapy for recurrent or refractory atrial fibrillation. Patient education is the following: consistency with anticoagulation therapy and INR monitoring, especially if on warfarin, avoiding triggers like excessive caffeine and alcohol, and recognizing stroke symptoms and seeking immediate care. Asystole. Asystole is a cardiac arrest rhythm characterized by the absence of electrical activity in the heart, leading to no cardiac output and no pulse. Contributing factors are the following: cardiac arrest from myocardial infarction, severe electrolyte imbalances or drug overdose, hypoxia, hypovolemia, acidosis, or trauma. Manifestations are the following: no palpable pulse or measurable blood pressure, unconsciousness and absence of respiratory effort, flatline on ECG. Diagnostic procedures are the following: ECG confirms absence of electrical activity, blood tests, identify reversible causes, for example, hyperkalemia, acidosis, arterial blood gases, evaluate oxygenation and acid-base status. Nursing actions are the following: initiate CPR immediately per ACLS guidelines, ensure airway management with advanced techniques if necessary, prepare for administration of epinephrine as prescribed. Treatments are the following: CPR and advanced life support. Focus on high-quality compressions and airway management. Epinephrine. Administer every 3 to 5 minutes during resuscitation. Reversible causes. Identify and treat promptly, for example, electrolyte correction, fluid resuscitation. Patient education is the following: for survivors, address underlying causes to prevent recurrence. Teach family members about CPR and automated external defibrillator or AED use. Ensure regular follow-up for cardiac monitoring and management. Ventricular fibrillation. It's a life-threatening cardiac arrhythmia characterized by rapid, erratic electrical impulses in the ventricles of the heart. This results in uncoordinated contraction of the heart muscle, preventing effective blood pumping. Contributing factors are the following: myocardial infarction, electrolyte imbalances like hypokalemia and hypomagnesemia, drug toxicity such as digoxin and antiarrhythmics, cardiomyopathy, and severe ischemia. Manifestations are the following: unresponsive and pulseless, apnea or the absence of breathing, and rapid and chaotic electrical activity on ECG, showing irregular QRS complexes. Diagnostic procedures are the following: an ECG reveals a chaotic rhythm with no P waves or QRS complexes. Laboratory tests check for underlying causes like electrolytes. Nursing actions are the following: initiate CPR immediately, defibrillation as soon as possible, administer medications such as epinephrine, amiodarone, or lidocaine, prepare for advanced cardiac life support or ACLS. Treatments are the following: defibrillation is the definitive treatment. Address underlying causes, for example, correct electrolytes or manage ischemia. Patient education is the following: post-event rehabilitation focusing on lifestyle changes, the importance of medication adherence, possible need for an implantable cardioverter defibrillator. Ventricular tachycardia, a type of abnormal heart rhythm or arrhythmia that originates in the ventricles, the lower chambers of the heart. It is characterized by a rapid heart rate, typically greater than 100 beats per minute, caused by abnormal electrical signals in the ventricles. Contributing factors are the following: structural heart disease such as myocardial infarction or cardiomyopathy, electrolyte imbalances, drug toxicity, long QT syndrome. Manifestations are the following: palpitations, dizziness or syncope, hypotension, can progress to ventricular fibrillation if untreated. Diagnostic procedures are the following: ECG regular wide QRS complexes, rate greater than 100 beats per minute, electrophysiological studies for recurrent ventricular tachycardia. Nursing actions are the following: assess the patient's stability, stable versus unstable. If stable, administer antiarrhythmics such as amiodarone. If unstable, immediate synchronized cardioversion. Treatments are the following: medications, beta blockers, antiarrhythmics, radiofrequency ablation for recurrent ventricular tachycardia, implantable cardioverter defibrillator for recurrent or sustained ventricular tachycardia. Patient education is the following: medication adherence and symptom monitoring, avoiding triggers like stress and excessive caffeine, ICD care and precautions if implanted. Aortic insufficiency, a condition where the aortic valve does not close properly, allowing blood to flow backward from the aorta into the left ventricle during diastole. Contributing factors are the following: rheumatic heart disease, endocarditis, aortic dissection, and hypertension. Manifestations are the following: exertional dyspnea, fatigue, widened pulse pressure, and bounding peripheral pulses. Diagnostic procedures are the following: echocardiogram to evaluate valve function and cardiac catheterization to assess severity. Nursing actions are the following: monitor for signs of worsening heart failure, encourage fluid balance and sodium restriction. Treatments are the following: medical treatments include vasodilators to reduce afterload. Surgical treatments involve aortic valve replacement. Patient education is the following: activity modification to reduce workload on the heart, and early reporting of worsening symptoms, for example, increased dyspnea. Mitral insufficiency, a condition where the mitral valve does not close completely, causing blood to flow backward from the left ventricle into the left atrium during systole. Contributing factors are the following: mitral valve prolapse, endocarditis, rheumatic heart disease, and myocardial infarction. Manifestations are the following: dyspnea on exertion, orthopnea, fatigue, and a hollow systolic murmur at the apex. Diagnostic procedures are the following: echocardiogram, chest x-ray, which may show pulmonary congestion. Nursing actions are the following: monitor for signs of heart failure, maintain fluid and electrolyte balance. Treatments are the following: medications, diuretics, beta blockers, and anticoagulants if atrial fibrillation develops. Surgical options include mitral valve repair or replacement. Patient education is the following: lifestyle changes to reduce cardiac workload, adherence to prescribed medications. Mitral stenosis, a narrowing of the mitral valve opening, restricting blood flow from the left atrium to the left ventricle. Contributing factors are the following: rheumatic heart disease, which is the most common congenital abnormalities and calcification of the mitral valve. Manifestations are the following: exertional dyspnea, hemoptysis, fatigue, and a diastolic murmur with an opening snap. Diagnostic procedures are the following: echocardiogram, ECG, which may show atrial fibrillation. Nursing actions are the following: monitor for signs of atrial fibrillation and embolic events. Encourage oxygen therapy if needed. Treatments are the following: medications, diuretics, anticoagulants, beta blockers, percutaneous mitral balloon valvotomy, or valve replacement. Patient education is the following: recognizing symptoms of worsening stenosis, importance of anticoagulation therapy. Mitral valve prolapse is a condition where the mitral valve's leaflets bulge or prolapse into the left atrium during systole, sometimes causing blood to leak backward, which we call regurgitation. Contributing factors are the following: a familial tendency and connective tissue disorders, such as Marfan syndrome. Manifestations are the following: often asymptomatic atypical chest pain, palpitations, and a mid-systolic click on auscultation. The diagnostic procedure for this is an echocardiogram. Nursing actions are the following: reassure the patient about the benign nature in most cases. Monitor for palpitations or arrhythmias. Treatments are the following: Beta blockers for palpitations, rarely requires surgical intervention. Patient education is the following. Avoid stimulants like caffeine. Stress management techniques. Tricuspid insufficiency is a condition where the tricuspid valve does not close properly, allowing blood to flow backward from the right ventricle into the right atrium during systole. Contributing factors are the following: pulmonary hypertension, endocarditis, and rheumatic heart disease. Manifestations are the following: peripheral edema, ascites, jugular venous distension, and a holosystolic murmur at the lower sternal border. Diagnostic procedures are the following: echocardiogram and chest X-ray. Nursing actions are the following: monitor for fluid overload and edema. Encourage adherence to a low-sodium diet. Treatments are the following: diuretics for symptom relief, surgical valve repair or replacement in severe cases. Patient education is the following: importance of managing fluid intake, reporting signs of worsening heart failure. Well, there you have it. That ends this video on the cardiac system for nursing students. If you need a quick refresher again, come back to this video. Also, if you found this video useful, hit the like button, leave a comment so we can continue making more useful videos again. See you soon!